This is what we need. Okay, it's setting up our settings. We should be getting live in a few seconds. All right, cool. Let me just make sure we are live. We are live.
Hey, let's go.
I think we'll probably let me just make sure everybody can hear us in the chat here. I always double check just to make sure. What's up, everybody? If you can hear us in the chat, just give us a yes.
Hello.
You know what? I think that I'm going to put the view. Let me put this view better so we can see. Cool. Yeah, they can hear us. Okay, cool, man. All right, so we are good to go. So we're going to go ahead and get started. Yeah, we're going to get this ball rolling and we'll see what happens. So, all right, I'm going to do my intro here. So for the audio podcast. Hey, everyone, this is Victor from Cyborg for Life, and I want to welcome you to the 4th episode of Limb Lengthening Live, where the patients interview the guests in this live stream question and answer. And today I am joined by a cosmetic limb lengthening patient who goes by the name of Puro. Puro underwent bilateral stature lengthening on the femurs using the PRECICE 2.2 nails. And today he is here to answer your questions, okay, about the patient experience. So I didn't get any submitted questions, so we're gonna go straight to YouTube and answer some questions over at the chat. So let me go ahead and open the chat up and we're gonna get started here. How are you doing today, Puro?
I'm doing very well, very well.
Awesome, man. So we got your fans over here in the chat. So let's see here. All right, so people are probably still trickling in. I know we're doing a little earlier today just because people might be a little bit still at work and stuff. So, all right, so we have a question here. One person is asking, how much height did you get? Okay, so I guess a better way to kind of give some background is, when was your surgery? And then I guess what was your initial height, and then how much height have you gotten so far?
Okay. Yeah, so my surgery was May 27th.
Okay.
I was like 5'5.5", I would say. Okay. And I've gained around 2 inches so far.
Awesome.
So now I'm like 5'7", 5'8". Yeah.
Okay, very cool, man. That's really cool. And that's amazing. And you're going for the full 8 centimeters, right? For the femurs?
The full 8, man. That's right. Or the hard ones do it.
That's awesome, brother. All right, so we got some other questions in here. So let's see here. I'm going to pin this one. So Zenosaman's asking, where did you get your surgery and how expensive was it? Okay. Well, I guess, yeah, just where did you get your surgery done?
Yeah. I got it done at the Paley Institute. So okay. Number 1 in the country, you know.
Yeah.
Gotta flex that, of course. And so, yeah, of course, it was a little pricey, but
yeah. Awesome. Cool. Okay. So Paley Institute. Let's see here. Who was your surgeon? So that was Dr. Paley, Dr. Robbins. So we won't.
That's right.
Yep. Okay. Yeah, everybody's just asking, where'd you get your surgery? So yeah, guys. So if you guys have actual questions, this is a limb lengthening patient who underwent bilateral stature lengthening of the femurs. So you guys always want to have questions in the interviews for cosmetic limb lengthening patients. Don't make me ask questions because I got questions. But all right, so let's see here, Pierre. So you got your surgery. You said May 22nd. What was it? Or
May 27th.
27th. Okay, so May 27th. Yeah. So we're about 2 months in. You're about 5.6 centimeters in. And let's see. So you said to me right as we got onto the live chat, you basically said that you had some nerve pain recently, right?
Oh my gosh, yes. So basically, yeah. So this started like 2 days ago. My right leg was just stinging from all the way from my foot all the way to like my glutes. Uh-huh. And it was just stinging like crazy after I stretched. Wow. And so I went to bed. I took Advil. You're not supposed to take ibuprofen too much, right? But like once in a while, it's okay because, you know, sometimes stuff pops up. So I took some Advil. I went to sleep. I woke up and I was totally fine. All good.
Yeah.
I stretch again for the first time of the day. It starts stinging like crazy, even worse than the day before that.
Really?
So now it's gotten to the point where it's like extreme. And the physical therapist told me that it's I guess just the tightness irritating my sciatic nerve,
Mm.
which is a nerve that goes all the way from the foot all the way to like your back, pretty much.
Yeah, yeah.
So that's what they said it was. But damn, that thing stings like crazy. But they do have a remedy for it. It's like a nerve pain kind of medication.
Mm-hmm.
But it's some serious stuff. So you have to weigh the pros and cons with it.
Yeah,
Yeah.
yeah. That's for sure. Is that yeah, and there you said that was like, was it on the left leg or the right leg?
Right leg.
Right leg. Okay, gotcha. And it kind of simmered down a little bit since it happened, or is it still kind of bad?
Yeah, it simmered down like an hour ago, but it was pretty bad, like all day.
Oh man, dude. So as of today, it was bad. Oh wow.
Yeah.
All right. Well, so we're not gonna try to keep you too long. I mean, obviously we have so many questions there, but okay, we appreciate you coming on.
Yeah.
All right. So we have some questions here. So let's see here. Let me ask this question. Do you use a hold on this? Do you use a wheelchair? And are you staying at one of the Paley endorsed hotels, I guess nearby his center?
Yeah. Yes, I am. I'm staying at the, well, I probably shouldn't say, but yeah, I am staying at one of them. And I don't use a wheelchair too often because I have the rods in my leg that can support my weight. It's like 75 pounds each.
Okay.
So it supports a total of 150 pounds, and I weigh like 120 right now. I lost like 30 pounds throughout the process. So
wow, 30 pounds.
Yeah,
That's crazy.
30 pounds. I know. So I'm allowed to stand up straight, like without any support.
Yeah.
So I don't have to use the walker too much or the wheelchair, but I use the crutches a lot.
Okay. Wow, man, that's incredible. Yeah. So, yeah, considering you're only just a little, like 2/3 of the way there, you lost 30 pounds. That's crazy. Yeah. Dr. Juan, he's basically saying gabapentin. That's probably the pain medicine that you were probably recommended, right? Yeah. That's they use it a lot for nerve. Okay. So let's see here. Okay, we have another question. What was the worst problem that you had during your lengthening so far? I guess, was it the nerve pain or was it something else?
Oh, it was maybe it's connected to the nerve pain. I still don't know. But what happened the first 2 weeks was that they approved me for the pool, right? And so I was really confident. I was feeling good. I went in the pool, and because I was feeling so good, I actually took it too hard.
Oh, really?
I started swimming faster than I should have. I started walking faster than I should have. And so what it actually did is it kind of strained the muscle near my groin area. And so like an hour after I got in the pool, that area started stinging like crazy. And I don't know if there's ladies that they probably can't relate, but like us dudes, that area is like really bad if it hurts. Like I mean, like my nuts were like inflamed. All right. So that's what I'm talking about here. So like all sorts of things could happen, especially if you push yourself too far. And so that's what I did by mistake. And till this day, that area still hurts.
Wow, that's crazy.
Insane. I had to see a urinologist. I went to the ER because it was hurting so bad. Yeah. And they said like there's nothing they could really do. You can just let it heal and that's it.
Wow, man, that's crazy. That was when was that? How long ago was that?
That was the first 2 weeks. So that was a while ago.
Okay. So
yeah, that was like early June.
That's crazy. And that's healed up since then?
It has not.
Oh, it has not. It's been strained groin muscle. Groin muscles and those adductor muscles, they can take a long time, like up to 8 to 12 weeks to fully heal. I actually have
if you're stretching,
yeah, for sure. That's crazy, brother. All right, so let's see what else we have over here in the chat. Okay. Yeah, Doc One, I'm not going to say the hotel here, but yeah, I think you might be on the one. You probably know. So, okay, guys, go ahead and pile it in. So, some other topics to kind of jar you guys is I'm going to send something in the chat here. I'm going to say length, pain, physical. This is what you guys got to ask. Therapy, because you guys will ask me tomorrow, but this is an actual patient right now who's lengthening. All right. Anything on those topics, guys? Go ahead and ask away. Puro's here for you. He's sacrificing his pain.
That is right.
So how's your physical therapy going? Are you still going 5 days a week?
Oh yeah, from the beginning, you go 5 days a week at Paley.
Yeah.
So I've been doing that. Sometimes I try to get Saturdays, so 6 days a week.
Okay.
But I got really lucky. I actually have a caretaker who knows how to do all the stretches.
Oh, nice.
So she actually helps me with it when I'm not at physical therapy. So it's like having physical therapy like 2 to 3 times per day, every day, you know?
Yeah, for sure. No doubt,
Yeah,
no doubt on that. Okay. All right, so let's see here. This person is asking, let me just go ahead and replace this. Okay, so this person's asking, well, he's asking, do your nails bend or break if you walk without crutches? He mentioned that a little earlier. He said that he actually is beneath the weight limit of the capacity of the nails, so he is okay. Let's
Well,
see.
I can stand. I cannot walk.
Oh, right. You can stand without
yeah.
support, but you can't walk.
Yeah.
You're right. You use the walker though, not crutches, or what do you use for walking around?
I could use either one. I mean, they're pretty much the same. It's just the crutches like give you, more speed.
Yeah.
And the walker is like a little more safer. Like if you have, like I had a lot of nerve pain today, so I use my walker.
Gotcha.
It gave me that support. Yeah.
Okay. Very cool. Awesome. Somebody's asking, do you see the procedure getting cheaper in the next few? We'll answer some of those questions a little bit. We're going to ask more about his actual experience. So if this person's asking, I don't know if they were here earlier, but they are asking, what was your initial height and what is your goal? So if you want to answer that one more time.
Yeah, I started at like 5'5.5", so I'll end at like 5'8.5" or so. So I'm going for the max 8 centimeters per leg.
Wow, man, that is so cool. So we wish you good luck on that. All right, let's see
Thank
here.
You, man.
You're gonna make it. We're gonna make it
for sure.
Yeah. Somebody's asking Dr. Paley and Dr. Robbins more like Batman and Robin. What? I don't even know what that's supposed to go. That's just another comment. There'll be some questions here in a minute. They take a few minutes to get warmed up. So, guys, he is here.
Okay.
Yeah. So unless you want to talk about anything,
you got?
Right now I think we have just about 23 people watching, live, which is pretty good considering,
Okay.
and then we have people in the chat and obviously a lot of people watch it later when it goes off air. So we're just trying to entertain them. And this is their opportunity. Cause like, I know on the interviews that I have, I come up with all the questions. And then they say, well, you should have asked them this. I'm like, well, here's your chance. All right, here we go. So, I mean, this is, I'll just ask this. So if one nail can take 75 pounds, can you stand on one leg? No.
Because I'm over 75 pounds. So. I'm not that skinny.
Right. I'll just answer this question because I mean, it's a redundant question. Where did you get your surgery? Who's your surgeon? He got it done at the Paley Institute. And Dr. Paley, Dr. Robbins are his surgeons. Okay, this is a good question. Do you have any pain right now? Yeah.
Actually, at the moment, I don't. I am chilling right now.
Really? That's crazy.
And I have like no pain meds right now that I'm on.
Okay. Wow.
So yeah, it's legitimate chilling right now.
Yeah, you know what? I think I saw a question earlier. It came in. It's somebody was asking like, how did you get off of pain meds and when did you go off of pain meds?
Yeah, I stopped taking pain meds after I believe the 4.5 week mark.
Okay.
That's when I completely stopped taking almost everything.
Wow.
I stopped taking Oxy at the 3 week mark though.
Okay. Because
Oxy was really messing with it messes with your bowel system a lot.
Yeah.
Bowel movement. So you definitely want to stop that as soon as possible because it's not fun.
Mm-hmm. Yeah. That's for sure. All right. We got another question. How much did you prepare before the surgery?
Basically nothing. I basically did not do any stretching or anything like that.
Okay.
I kind of just jumped into it right away. But for some context, I am 20 years old, so I don't know if that affects how much pain I'm having right now. Because I have another 20-year-old friend here, and he does all this stuff you're not supposed to do, and he is healing like a butterfly or something. Like he's just doing so well.
Really?
And It's amazing. So I think it's making me realize how much it plays a role.
Yeah, for sure.
So yeah, I don't know if that plays a role in the pain like area like right now. I don't know, if an older person would be feeling more pain,
Yeah. No, that's a good topic you brought up. I'll have to kind of like dig into that a little bit more. And I think I mean, if you're healing more damage, you probably are going to relieve the pain a lot sooner, but that's a good one. I'll have to kind of ask around about that and get some more patient feedback. Okay. So, here's a good one. How did you get support from your family? If they supported the decision at all? And if not, how did you convince them? That's a good one.
Yeah, my family was actually very supportive of it. I'm not gonna lie. It wasn't that hard to convince them. I kind of been complaining about my height for years now.
Oh, really?
So maybe they just wanted me to shut up. I don't know. But Yeah, it really, I think I'm in a unique situation to where my family was very supportive. And so I basically told them everything I was doing at all times.
Okay.
And so I was lucky to be able to do that. But yeah, some people do this alone completely. So yeah.
Okay. Very cool. Let's see here. Okay, so under the sticker price. Okay, is your physical therapy, X-rays, medication covered under the price of the health insurance? Does your insurance cover any of the physical therapy, or was it all covered in the main fee?
Everything's out of pocket, man. No
Okay, out
insurance.
of pocket. Yeah, because it's
Yeah,
cosmetic. Yep. Okay.
rough, man.
Here we go. We got another good one. Did you get epidural, or did you get general anesthesia?
Anesthesia.
Okay,
Yeah.
general. Okay, yeah, that's what I got. Very cool.
Yeah.
All right, here we go. Here's a good one because I think you're in school, right?
That's
Yeah.
right.
So somebody's asking about this. They're saying, do you feel like you'd be able to squeeze in studying for university exams if you had studied during the experience, or should you take a semester off? So how'd you deal with this with school as the semester was wrapping up?
Yeah, so basically I have the summer off right now, so I'm doing this during my summer vacation, but I
Okay.
did have summer classes set up,
Yeah.
and I was not able to study at all for that
Really?
during that time. It was pretty bad. Mainly because it started during the time when I had a lot of pain.
Okay.
But could I do it now? I guess if you really had a drive to do it, yeah, you probably could.
Yeah.
But yeah, it definitely depends on like your experience. I mean, everybody's so different. Everybody's experience is like so vastly different. It's hard to say, you know?
Right. Yeah. So like you said, like you're at no pain right now. You're at like 6 to 8 weeks right now.
Uh, maybe 8.
8. Okay. Yeah. So about 8 weeks.
Yeah, I don't know.
Okay. Yeah, that's good to know. Kind of that's good feedback because I've heard from a few other stature patients saying that about 6 to 8 weeks is when they like kind of notice that they're able to kind of start to refocus on tasks like that. But
Yeah,
cool.
yeah, for sure. Like right now, I could probably study. You know what I mean?
Yeah.
But like a couple weeks ago, definitely not.
Okay.
Definitely not.
Good topic. Okay. This person's asking, which pain is worse for you? Was it muscle pain, nerve pain, bone pain, or even the mental pain? That's a good question.
Oh, nerve pain for sure.
Nerve pain
is a different league. Muscle pain, I feel like you've dealt with it in the past if you worked out before, right?
Yeah.
And skeletal pain, I don't really feel my broken legs at all. You know what I mean? You mainly feel that in the first 2 weeks, and then it kind of goes away. But the nerve pain, it's the weirdest thing you could ever experience, man. It's like, I don't even know how to describe it. And it can come in so many different kinds of like forms. Like there's not one specific nerve pain. There's like 1,000 different kind of nerve pains. So I hate nerve pain the most by a mile.
Wow. Yeah, no, that makes complete sense, especially doing the femur lengthening. You said the sciatic nerve. That's one of the most annoying nerves in terms of irritation.
Oh yeah.
Okay. So somebody's actually, you were digging a little deeper on the nerve pain. Could you please tell us more about your nerve pain progression, and after which centimeter did it trigger, and how have you stopped it? Well, yeah, like it's still going on, but like when did it really start up? Like after what length did it really notice? Did you notice?
Yeah. Well, actually, I've had different variations of nerve pain.
Yeah.
So at around the 3 centimeter mark, I had a tiny bit of nerve pain right under my left knee. So it kind of felt like hot water was getting poured on my leg whenever I tried to stretch it, which is very weird. It's a very weird feeling.
Yeah.
But after, like a couple of days of stretching, I would say 5 to 6 days of stretching, it went away.
Okay.
And so that was just, weird stuff just pops up sometimes. But then, like I said, a couple of days ago, my sciatic nerve was on my right leg was being irritated. Do you want me to tell the whole thing, or?
Yeah, sure. Yeah, that's what they seem to want to know about. Yeah.
Yeah. So it kind of just happened from me stretching. That's the only explanation I have right now. So I stretched 2 days ago, and it started my right leg, my entire right leg started stinging like crazy. Then it went away when I went to sleep, and then the next day, once I stretched, it popped up again, and then every time I stretched till this day, it just kept stinging. So this afternoon I stretched. It stung the most it ever stung before. It was terrible, but it seemed to have gone down for now. Like it seems to go down after like an hour or two.
Okay.
Of me not stretching, and so that's what happened now. I mean, the physical therapist, that's what they're saying. They're saying it's a sciatic nerve because it seems to travel from my foot all the way to my back.
Right.
and I could literally, now that they pointed it out, I could literally like feel the nerve like stinging itself. So
Yeah.
it's definitely nerve pain for sure. And I mean, the only explanation I have is that I'm just tight,
Okay.
you know, and the nerve is getting irritated. Yeah.
Wow, man, that nerve. Yeah.
But for context, for context, I don't know, is this delayed a little bit? I think it's delayed, right? But for context, I do stretch a lot.
Okay.
So it's not like I'm not stretching at all, because usually people assume that if you have nerve pain, you don't stretch. Even if you stretch like crazy, you could have nerve pain. Like it's just unavoidable. So I just want to like get that across.
Right.
Yeah.
That's good. That's good advice. And when you're stretching your hamstring, do you keep your knee fully straight or do you slightly bend it? Did they tell you about that at physical therapy? Because I know the sciatic nerve is triggered a lot with a full extension of the knee when you're stretching the hamstring. And if you slightly bend the knee, did they talk about that?
They did talk about that for sure. I do see, for me, in my case, it's not every patient again, but in my case, if I completely stretch my legs and I try to like bend over for the hamstring stretch, I do get a lot of nerve pain. So they did tell me to bend my knee slightly when I try to stretch my hamstrings. But even then, they'll sometimes be irritated. You know what I mean? Yeah. So sometimes it's like you have to go hunting for the stretch. You know, like try all different kinds of stuff to try to stretch like your hamstrings or your quads or whatever. Yeah. But yeah, that's how it goes. Yeah.
Yeah, no. I mean, you're literally extending the stretching out the nerve, so it's going to get irritated. Okay, very good. This is good information for them to know. So if they're considering femur lengthening, nerve irritation is one of the things to expect. Okay, so let's see here. Moving right along. Next question is: have you developed anterior pelvic tilt during lengthening, and if yes, to what degree?
See, in my view, when I look in the mirror, I don't see anything, okay? But every now and then a physical therapist is going to talk smack and be like, oh, you have duck butt. It's like, no, I don't have duck butt, all right? It's like duck butt by choice. It's a more comfortable position. Yeah. But so in my view, I don't think I have a tilt, but some would say I do. It's not at the point where it's severe. I would say that.
Gotcha. All right. Yeah. Very cool. Awesome. And they're not too worried about it. They're just saying like, just watch out for that.
They're just talking smack, I swear to God. Okay. But I feel like you'll be able to tell yourself when you do the stretches, you know, you could feel how tight your hips are and whatever.
Right. Yeah, for sure. Okay.
Yeah.
All right. Let's see here. How flexible are you to begin with without the preparation? Okay. Well, he didn't do any preparation before surgery. He mentioned that earlier. Okay. Moving right along. All right, here we go. All right. Were you athletic? Did you play sports prior to surgery? If so, what did the doctors tell you about athletic ability post-surgery? Okay. Fair question.
Yeah, I am somewhat athletic. They did say I would return perfectly to normal. I mean, they tell every patient that, as long as you follow their guidelines. I mean, to be honest, but yeah, I was athletic before. I did wrestling. I did soccer and stuff like that, and weight training. So yeah, I was definitely athletic, and I do believe it may have affected my pain tolerance, made me more sensitive to it, but I am not sure.
Okay, very cool. All right. All right, let's see here. I'm trying to see. I just jumped around. Okay, here we go. What supplements do you take?
That's a good question, actually. So they give you vitamin D like as a standard supplement, and then they tell you to take Xarelto, which is the medication with it. But aside from that, the only supplement that I've started taking is what's it called? Glutamine. That's what it's called. I know a bodybuilder told me about it. I'm sure you know about it.
Yeah.
But they said it's really good for muscle repair, so I just started taking that. But aside from that, I really don't take much. I mean, I'm not gonna lie, I do consume a lot of weed products because it helps with the pain. So I don't know if that counts as a supplement, but yeah, there's that.
All right, very cool. And all right, let's see. And Puro, how much length did you achieve? You said 5.6 centimeters so far?
Yes.
Okay, I'm just going to type that in the chat so everybody, because some people are just hopping in now. They're wondering where you got your surgery done, how much length you got and everything. I'm just going to type that in so far. Cool. All right. So let's see here. Missed the full price. Okay. So after surgery, I mean, did you have a catheter? Yeah. Okay. Did you have a catheter for your surgery, and did you feel a lot of pain when they took it out? Yeah. You want to answer that?
The catheter? Can you explain
Yeah.
what that is?
So it's like yeah, it's for urination during surgery, like the little
Oh, like the urinal thing.
yeah, the urinal tube thing. Yeah.
Yeah. Wait, what are they asking? How long did I use it?
Basically, do you remember the process of them? I guess were you somebody's terrified about it because like it goes into your urination tool.
Oh no, they didn't do that for me. They didn't do
They
that
didn't.
for me.
Yeah, I didn't have one
No,
either.
holy cow, that sounds terrible. No,
I
you don't have to do it.
know. Yeah, some patients don't get it because like I just didn't drink anything before, and Dr. Conway, it was real quick for me, so it was like actually it was a long surgery. It was like 4 or 5 hours, but
You had one?
what lengthening surgery?
No, the catheter.
I did. I don't think so. I have to ask Dr. Conway actually, but I don't remember having it. If I do, they took it out before I woke up. So
Okay.
yeah.
Okay.
Okay, moving right along here. Are you noticing more tightness as you're going from where you were to where you are now?
Oh yeah.
Okay.
Sometimes it hits you like a truck too. Like you just wake up and you're like, wow, I've never felt this tight before. But yeah, it definitely gradually gets tighter no matter how much you stretch.
Yeah.
And that's just how it is. It's like a race, like a marathon, man. So,
yeah. Sure. Okay.
yeah.
All right, cool. So we'll try to get some more questions in here. Let's see. We're just approaching 30 minutes. You got more time, Puro?
Yeah.
Okay, cool. We'll just go, okay, because they're starting to pile in now. So did you say glucosamine?
Yeah, I got it. Go ahead.
He said glutamine. So
Glutamine.
it's like, yeah, it's a little different than glucosamine. It's more of like kind of a recovery amino acid, but yeah.
Yeah.
Does he have a diary or a YouTube channel with updates on the process? I don't. Yeah, is that
No.
no. Yeah, he's just gonna keep this. Yeah, this is just him doing this as out of the kindness of his heart to come on and share his experience. So. All right, let's see here. What else we got? Okay, so yeah, somebody's asking again about physical therapy. How often do you have physical therapy per week, and what kind of interventions do they do or focus on most?
Interventions. Okay. So yeah, I do it 5 times per week, sometimes 6 times per week if you could like snag a Saturday. But interventions, I mean, they kind of just see how you're walking into like the physical therapy department, and they kind of judge you based on that. Like they could see if your hips are tight or if you're struggling to straighten your leg or something like that. Right. So I feel like at least at this tightness level, that's how they could, prioritize certain stretches to do with you.
Okay.
But aside from that, they kind of rely on what you tell them.
Yeah.
Like if you say like your hips tight, they'll do extra stretches there and stuff like that.
Yeah. Okay. So they kind of just do as what's needed along the way.
Yeah.
Okay.
Exactly.
That's really good. How soon would your surgeon advise that you could start jogging and jumping?
Jogging. Oh, that's probably in a while. I'm not gonna lie. I mean, we honestly didn't talk about it too much. I'm sure you probably know more about this. But they do tell me that I'll probably be able to walk around the end of October.
Okay.
So I don't know if that gives a timestamp for that guy, but yeah.
Okay. Yeah, that gives him. Yeah. All right. So that's about 5 months into his surgery. That's about, for stature lengthening patients who achieve 8 centimeters, they start to walk around then.
Yeah, but I don't know about jogging and jumping. That's a whole.
Yeah, probably a little later, closer to the new year, I would assume. So
yeah.
Somebody's asking, do you feel taller yet? This is a good one.
Oh yeah, it feels amazing. The air is cleaner and stuff. Oh my god, I'm just like towering over people. It feels absolutely amazing.
Really?
That's like it. Yeah.
Wow, that's cool, brother. I'm so happy for you. That's awesome. And that's so cool when you notice the height difference.
Oh yeah.
Yeah. Awesome.
Definitely.
Okay. Do you notice that your knees hurt?
Yeah, in different ways. I actually have this, I guess it's called a common like abnormality, where my knee socket, it's not like perfectly straight. It's like somewhere like slightly to the side. Okay. And so if I try to do like a knee bend stretch, the blades will just feel weird. It'll just be very uncomfortable and painful. Gotcha. But I also have knee pain because I kind of struggle to strain my leg perfectly around this tight mark. Like I'm really tight. Like I guess in my hamstrings and my calves. And so sometimes when I try to straighten my leg, it'll put stress on the knee, and that'll kind of hurt. But aside from that, it's like kind of just general discomfort, nothing too serious.
Okay, gotcha.
Yeah.
Okay, good. The sciatic nerve is way worse than knee pain, I'm assuming.
Oh my God, yeah, way worse. You can't get rid of it. It just stings. You have to deal with it.
Dang, dude, that's crazy.
Yeah, man.
Okay, so let's see here. How soon after the surgery does the pain begin? Okay, so this is going to be more of a kind of a kind of the different pain phases. So like after surgery, what was the pain like? Then like give us like a 1 month post surgery, and then obviously you said right now you're not like hurting at all, but like besides the nerve pain, but like tell us how you felt right after surgery. I think that's a big question that people always want to know. Like when you woke up first 3 days before you got discharged, what was that pain level like?
Well, the first like 4 days, like when you're in the hospital, some people hate that.
Yeah.
Those first couple of days, I loved it because you have so much pain medication just freely available, and you're like on cloud 9 all the time.
That's true.
But as soon as you get to the hotel, I mean, it's hell on earth. Like, I'm not gonna lie. I mean, at the hospital, you kind of felt your broken bones, but at the hotel, you really feel it. I mean, you have to use the bathroom, and you have to sit on your broken femurs. I mean, that is the worst pain. Imagine, oh my God, it was terrible. And you're also like, at least for me, I had like fevers every night. I would wake up and like covered in sweat. My knees were always super inflamed.
Mhm.
They looked like they were like bubbles. That's how inflamed they were. It was nuts. And basically just your entire bottom half of your body just hurts like hell, insanely. Even your feet will hurt. Like, it has nothing to do with the surgery. Your feet will hurt. Sometimes my shin still hurt sometimes. But yeah, like back then everything hurt extremely, and it doesn't subside until I believe you say this like the 3-week mark.
Mm-hmm.
That's when it like starts to really subside. But I mean, geez, that first 3 weeks is absolute hell. I'm not gonna lie. And then after those 3 weeks, I would say I kind of got lucky. I don't know if this has to do with my age, but I had like 5 weeks or like 4 weeks of just a honeymoon phase. I had a long honeymoon phase, like super long.
Yeah.
So I was kind of chilling. I had slight nerve pain under my knee or so, but it would usually go away in like 4 days.
Mm-hmm.
I mean, you're kind of just dealing with the stretches after the 3-week mark or the 4-week mark. I mean, the one thing you have to fight is that you're going through a lot of pain and you're not even at the halfway mark. That's probably the worst thing you have to deal with. Like, it's kind of a mental struggle, but besides that, after the 4-week mark, you're kind of chilling.
Mm-hmm.
And then I would say at the 5 centimeter mark, that's when you start getting pain related to tightness.
Yeah.
And I mean, I'm still doing well. Like right now, I have like no pain at all. But after you stretch, you will feel a lot of pain, and it won't subside for like an hour or so.
Okay.
Like, you'll just feel beat up and broken. Like,
beat up and broken.
I mean, if you're doing your stretches right,
Right. Yeah. Because those muscles are getting tighter as you go along. That's for sure. Yeah. Oh man.
That's true. Yeah, exactly. So, and also like you're kind of like when I was doing the knee bend stretch, it would put a lot of pressure on my back because my pelvis would try to compensate for, I guess, the area that's being stretched. Right. So my back would be killing me after I was done with the stretch. And it has nothing to do with what I was doing, but you just feel really beat up and everything just hurts like crazy. It's just
that's crazy.
Yeah.
All those muscles of the posterior chain are interconnected, so it's going to pull, one tugs on the other one. So dang, dude.
Yeah. And you're continuously stretching and not doing a lot of healing.
Right.
So you're kind of just beating yourself up over and over, and your body's like, please stop. And you just got to keep going.
Right.
So,
oh my gosh, dude. Yeah. Well, you're a true soldier, man. Just pummeling right through it. That's awesome, dude. Good job. Yeah, I remember a lot of surgeons say that the 5 centimeter threshold is like after that things just get tougher. So
yeah, by a lot.
By a lot.
Yeah.
Let's see here. Okay, I guess we'll ask this one. Do you notice that people treat you better? I mean, I guess you're still in the hotel and you haven't really got back to normal life yet, but like, have you seen anybody like from the normal public kind of treat you better? I guess I don't know. Too soon for that.
I don't think that's fair for me to judge yet, because you get a lot of privileges for just being in a wheelchair, kind of. You know what I mean? So I don't know if that kind of skews my view a bit. I don't know.
Right. Yeah.
But yeah.
Okay. Do you think you will go for the full quadrilateral lengthening or only the femurs?
See, this is something I've been thinking about.
Yeah.
With the current PRECICE now, no way I would do tibias.
Okay.
I'm done. I'm good with the femurs. I'm feeling great.
Yeah.
However, if, like I said, I'm 20, so I'm really young. So if like in 5 years, right, let's say the stride nail came back and it was just amazing, the recovery time was much shorter because of some new medication, I don't know. I would think about doing it again, because the stride nail, the fact that you could wait there and walk, just makes the process so much more enjoyable.
Yeah.
I hate being in bed, man. It is awful. So I mean, the stride nail, it really makes a difference. So I actually would consider doing, tibias if that process was reformed.
Okay. All right, cool. So it is up in the air.
Yeah,
So it's not like not a hard no right now.
It is
so
up in the air.
Okay. Very cool. That's
Yeah,
fair.
yeah.
I like it. I like it. And I think they want to hear that too. That's awesome. All right. So did you have an IT band release? I think that's pretty standard. Did they do that for you?
Yeah. And sometimes you can feel it too. Like
really
where they cut.
You can feel it.
Because they cut the IT band, if what I know is correct, right?
Yeah.
They like cut incisions in it,
yep.
right?
Mm-hmm. Mm-hmm.
So yes, it may be placebo, but sometimes I believe when I touch my knee, I could like kind of feel it. I don't know. Maybe that's in my head. But they definitely did cut mine.
Is it like a pain, or is it kind of like
it's kind of like when your IT bands are tight, you'll just feel extra pain in that area where it attaches to the knee.
Okay. Gotcha.
So yeah, it's kind of hard to describe. There's just so many different types of pain. It's really hard to describe, man.
No, this is good. This is what they kind of want to know. They want to kind of get that,
yeah,
what to expect kind of feeling vibe. Okay. Oh, somebody's talking about tibia lengthening resulting in permanent knee pain. Did Dr. Paley talk about it? Well, he probably didn't talk about it because he got femur lengthening. So we'll pass on that one. Okay, here we go.
Oh, I didn't even know about that.
Yeah. I mean, really, it depends. I had tibia lengthening 9 years ago. I don't really think my knee pain's from that, but I need more patient cases from tibia lengthening. I'll get back to everybody on that one. Okay. Are you worried about your tibia femur ratio, aka your proportions? That is, are you worried that your femurs will be too long compared to your femurs will be too long to your tibias? I think he means at 8 centimeters.
Yeah. My femurs were actually shorter than the average person.
Oh, okay.
And so they were actually I was actually disproportionate to begin with, and so this actually kind of fixes that, which is really nice. And also, one leg was slightly longer than the other, which would have caused hip pain like 50 years.
Yeah.
So yeah, this also helped me with that as well. So now my legs are going to be even and proportionate.
That's so cool, man. I love when people get other problems fixed when they are getting this done.
Right. Yeah.
That's cool. So you're going to fix your proportions and fix your discrepancy. Very cool.
That's right.
Which one has less recovery time, femur or tibia? It depends on the person. So we're going to skip that one. It is recommended to use shoe lifts. Okay. Have you ever used shoe lifts in the past? And after the procedure, do you plan to ever still use them? Consider to still use them?
Yeah, I used to use shoe lifts in the past. I actually used to, I don't know if you guys know Guido Maggi. I used to get shoes from them. They make like elevator shoes that are really fancy.
Oh yeah.
They look amazing. So I mean, simply because the shoes were so expensive, I probably will wear them again and just see what it's like to be like 6 feet tall.
Right.
So like might as well, right? But like for the most part, I am gonna enjoy just wearing flip-flops and just enjoying the raw height,
Okay.
So
gotcha.
Yeah, cool. We'll see what happens. But I probably will wear the lifts in the future. I'm not gonna lie, just for the fun of it.
Exactly. I mean, it can't hurt. It's like you're just getting extra height from that. So
exactly. Yeah.
You got into it for the height, so go all the way. All right, Piero. Somebody is asking, do you do hip bridges or hip thrusts as part of your daily, stretching and activity or exercises? If yes, how far does your butt go up when you really push it towards the ceiling?
Oh dear. I don't do them daily. I do my physical therapy, and to be honest, I'm not really sure how high it goes up. But yeah.
Okay, gotcha. So you do it.
Sorry about that one. I don't know too much about that one.
Okay.
No, I don't do it daily.
Okay, gotcha. Okay.
Maybe my hips would be better if I did. I don't know.
Let's see. I underwent this surgery at 39. I would have killed to do it at your age of 20 for healing purposes and a longer time to enjoy the height increase. Yeah. Okay. Yeah. That's for sure. But hey, man, height at any age is a good thing. It's a cool thing. You can live it up to the thing.
That's right. That's right.
Let's see. Do you have any knee pain, like bow legs by lengthening day by day? Okay. So that's kind of a question that he already answered. So he doesn't really have actual knee pain from, he says he gets it here and there, but it's not as bad as his nerve pain. Let's see here. I'm trying to find any other questions. Okay, here we go. Okay, so if you were considering both tibia and femurs, why do the femurs first? Was it because you can get more height?
Yeah, it kind of was the fact it gave me more height, and if I did it, I would probably be done with everything. You know, okay. I don't have a strong will to do both. I'm just kind of open to it.
Yeah.
So just getting the maximum amount of height as soon as possible is kind of what I wanted to do. So, you know.
That's smart. Yeah. And if you never go back, at least you got the most amount of height you can with the femur stuff.
Exactly.
That's smart. Okay.
But I'm also I am a strong believer that you should give your body a good amount of time to heal before the surgeries. Like some people do tibias and then they do femurs like right after, which is insane to me. I strongly believe that you have to wait like a couple of years and let your body return to its normal state before you get another surgery like that. But it's heavy. It's really hard on the body.
Right. Yeah. I completely agree. I've talked to probably 4 to 5 quadrilateral patients and got a lot of information from this year. And they all suggest the same thing after going through it. They're like, give yourself that year break, catch up, get full flexibility back, and then you can go for it.
That's right.
Yeah. Okay. What advice can you give us who haven't gone through the surgery to help prepare for it? Mental advice, physical advice, any type of advice you can leave.
Oh yeah. I mean, when it comes to the pain, there's no way to prepare for it. I'm not gonna lie. I mean, I do have a friend though who's also, I believe he's 23. He stretched a lot. Like I believe 3 months before the surgery, he stretched like crazy. Really? And he is doing amazing right now. He is able to do just all kinds of stretches, man. He is doing really well. So stretching a lot in those 2 or 3 months before surgery can really make a difference. And I kind of wish I did that. So they asked about, what else did they ask about? Just overall advice, right?
Yeah, just overall, but so stretching beforehand. Did you mentally prepare for it as well?
I did not. I just kind of jumped in. So I don't know if you want to do that or not, but I feel like if you read, I mean, you definitely want to know what you're getting yourself into, but if you look too deep into it, you're not going to want to do it because there's so many horror stories that could happen. I mean, just thinking about blood clots alone would scare me off. I mean, I didn't even learn about how high the risk was until I was more into it. So once I learned about it, I was like, oh shoot, this is crazy. What have I done? So that's kind of my philosophy.
Gotcha. Yeah, dude, that's kind of like the same thing that happened to me. Like I literally had 3 weeks to decide before I had my surgery done, and I was like, I did some research. I kind of knew a little bit of what was happening, but I was like, let's just get this thing done, you know? So.
Exactly. I mean, as long as they say that you're going to be good by the end of it, I mean, that's all you need to know, right?
Right. Exactly. I mean, obviously you want to know how it works and stuff. And that's why, I put some information on the channel, but if you obsess about it, I think you can, like you said, you can talk yourself out of it. So
definitely.
Yeah, for sure. Okay. So this person's asking, from 1 to 10, which daily activities are the hardest to do now that you have, because if your femurs are broken? Taking a shower, going to the toilet, walking with a walker, I assume, sleeping, breathing, or something that you used to do before?
Let's see. Well, everything's difficult, but I mean, sleeping has actually become very amazing. I sleep I would say easily 18 hours per day.
What the 18 hours?
Yeah, an insane amount. I mean, I'm not gonna lie. I literally just get up to stretch and that's it. I'm not gonna lie. And I believe the only reason I still have some muscle left in my leg is because I could stand, Yeah. That really helps. So I'm literally never awake. I said before, I do take a lot of weed products. So I kind of I take it and I just knock out for hours. And then I wake up when my alarm tells me to stretch. So
You're hilarious. Oh my god. So
Yeah.
that's awesome. So he just takes some cannabis and then he's
That's
out
right,
for
dude. It's amazing. It's absolutely amazing.
That's hilarious. I love it. I love it.
Yeah.
Okay, cool. So hey guys, that's a new little piece of advice that he's giving cannabis.
Oh, that's huge. I mean, if you want me to go into that, I mean, I can.
Sure.
It's
Yeah.
such,
Actually, let's talk about that. Let's answer this question real quick, then we'll talk about that.
okay.
I guess this is a really good one. What motivated you to get this done? He had to go out for work and then he had to hop back in the live session. So,
Wait, say that again. What motivated me?
yeah, what was your motivation to get stature lengthening done?
Oh, well, I just hated being short for years on end. I mean, for like 4 years now, I don't know, it used to affect my confidence and how I felt about myself as a man and stuff like that. So,
Right. Okay.
you know, and I already feel so much better. It's like already fixed. So, I mean, it definitely works. I mean, shoot.
Would you say that you're like you're completely fixed, or do you think that you say, hey, look, once I get to the 8 centimeters, I'm gonna be like, balling?
I would say I'm already completely fixed.
Oh,
I would say I'm just going for extra right now.
Okay. Okay.
Just to say I'm hard and stuff, and I could like show off and whatever.
Bonus points. Love it. All right. Very
Yeah,
cool.
yeah.
Okay. Let's see. So, man, these questions are piling in. All right. So we'll go to the hour. Is that okay with you?
Yeah, that's fine.
Okay, cool, man. They're loving it now. I told you to take them in a minute. So, yeah. So let's talk about the cannabis right now. So you're sleeping 18 hours a day. I gotta get because I've heard a few patients do this. And I'm not like, advising anything. This is just a patient giving his experience. So, tell us a little bit about what you're doing with this.
Dude, okay. Cannabis is the number one savior throughout this entire process. Okay. I cannot stress this enough. Yeah. You are in the perfect atmosphere or environment to get like depression and stuff like that. Yeah, you're in your room all the time. You can't walk that often. Every time you're awake, you have to look forward to getting pain because you have to stretch like every 3 hours or so. Mm-hmm. So you're looking at you have almost nothing to look forward to, and you're in a dark room all the time, and it's really not it. So to fix that, you have cannabis, right? And so you just take an edible or two, and you are just chilling. If you want to sleep, you can take indica. If you want to stay awake, you take sativa. It also kind of helps with like gut health. So like like the Xarelto medication, right? Yeah. So this is like a blood thinner medication you have to take. It'll make you go to the bathroom a lot, or like at least make you feel like you have to go to the bathroom a lot, even if you don't. And this completely takes care of that. I am not gonna lie. No, I'm dead serious. Like no joke. Like if you do, there's studies that have shown that CBD at least helps with gut health, or you can use it to treat gut like problems.
That's crazy.
So yeah, so when I use this device, I mean, you're not supposed to smoke it, right? Because smoking is like bad for your bone health. Yeah. So you could either take it through edibles, or some patients who live on the edge a bit, you could use it as a vape device, because they say that they're not cool with vaping, but the consequences really end 72 hours after surgery from what I've collected. So, I mean, if you want a very instantaneous high, or you want to fall asleep right away, you use the vape pen. And then if you want like a long-term high, you go for the edibles. And it just makes everything so much more enjoyable. You won't get depressed. You'll stay at your like normal, healthy mental health, and it just makes it all the more enjoyable.
Wow, that is so. Hey man, that is fresh advice for me too. To like, I never heard of that, and that's crazy. And I guess it helps you sleep too, huh?
Oh, I sleep on demand. I literally sleep on demand. I will take 3 puffs of this thing and I'm out.
Wow,
I'm dead serious. Yeah.
Wow,
so
brother. I think that's huge, because then when you sleep better, it does help you manage pain, and you're kind of sleeping through the lengthening phase, which is the toughest part of this whole procedure. So
that is correct. And you'll heal very quickly, because a lot of my problems, like I said, they healed in like 4 days. You know what I mean? And I'm gonna blame sleep for that. Like I'm giving credit to sleep for that, because I slept so much. Dr. Robinson, my bone healing is pristine, perfect. So I'm also gonna give credit to the sleep for that. Okay. I mean, I'm also young, of course, right? But like the sleeping, it provides a lot of health benefits, so it's very important.
Yeah, that's 100% true. I mean, you said 18 hours a day, like literally, that's like more than 3 of my days in terms of how much I sleep. That's crazy, dude. I gotta give
I wake up at like 12, right, like in the afternoon. So that right there, half your day is done. You know what I mean? Yeah, like right there. And then I go to PT. I come back from PT and I sleep for like another 6 hours. So
God.
like, so it's amazing, man. But it
Yeah.
makes every day go by so much quicker. You
Right.
heal very quickly, and yeah, you have very little stress, and you feel great all the time.
That's crazy. That's awesome advice.
Yeah,
Okay, guys. So there you go. CBD
there
and
you go.
yeah, from another statute lengthening patient to you guys.
Yeah, technically, if someone's actually interested in it, I do use Delta 8, which is kind of like the legal weed. You know, I'm not
Okay.
getting it from a sketchy dealer or
Right.
whatever.
Right.
So yeah, so I would recommend getting it from the legal places. But also it really helps with comfortability, because you're gonna realize throughout the surgery, like whenever you sit down, you're comfortable. Whenever you lay down, you're comfortable before the surgery. Now, after the surgery, you will never get a break. You will always be in some sort of discomfort or pain. Like even if it's not a lot of pain, like you may just be too uncomfortable to sleep. And
Yeah.
so this helps with that big time. You will
Right.
always be comfortable pretty much, no matter what position you're sleeping on. You know.
Yeah. No, that's great advice. I think that a lot of patients they can't sleep. They can't sleep for up
That's
to
right.
6 to 8 weeks, and then they say, "Oh, I can finally sleep," but that this is a new intervention of how they can
Yeah,
get.
right. All my friends who got this the surgery around the same time I did, because you make a lot of friends here when you're actually doing it. They all have like 3 to 4 hours of sleep every day, and then I'm sitting over here with 16. You know what I mean? Like when I tell them, they're like, "Huh? Like what are you doing?" But yeah,
That's crazy, brother. I can't believe that. That's awesome advice. Thanks for sharing that. Okay, let's see here.
from
A lot more questions here. Trying to. I hear somebody at the door. Let's see here. How much taller? Okay. Have you ever felt height discrimination so? Yeah, I guess this is like pre-surgery.
Mm-hmm.
Yeah, so like height discrimination. Yeah, so like pre-surgery, and then like yeah.
But can you ask that again?
Yeah, sorry. So like, yeah, I didn't read the question. My bad. I'm like spacing out here. Have you ever felt height discrimination as a male person in society? Do you feel the surgery will help you get over it? He just missed your story, like when he.
Oh yeah. So yeah, I definitely felt height discrimination big time. I mean, some people may say I was looking too deep into things, but I mean, I'm already feeling better. So I have a feeling that I wasn't looking too deep into things. I already noticed an immediate difference. I don't know. I mean, a lot of this stuff is psychological, so it is kind of hard to see, if you were actually facing discrimination or not.
Right.
But yeah, I would say that the surgery has definitely helped me a lot already. I mean, at the first inch, you feel it.
Yeah. Okay. Very cool, man.
Yeah.
That's awesome to hear, because I think that as like you said, your height neurosis is already kind of like fading away, and then like height discrimination really kind of like I always believe it kind of starts with the person, like yourself, because like you really kind of how you perceive people seeing you, and obviously you're gonna people in society are just rude in general, but
Yeah,
but if you're more confident, like it doesn't really matter what they think, so
that's true. It's like a shield or something. Yeah.
exactly. Okay, so. Okay, somebody's just asking about lengthening. Okay, do you know how much vitamin D and calcium you're taking?
I don't think I'm taking calcium. I think it's just vitamin D by itself.
Okay.
And they do not say how much gram. I don't really see the amount right now, but they do give you vitamin D. I don't know if everyone takes calcium. I don't know about that.
Okay, gotcha.
Yeah.
All right, vitamin D is super important. Okay. What were your proportions? Okay, so he already talked about proportions earlier, so we're gonna skip that one.
Wait, is calcium? That's totally separate from vitamin D, right? They don't usually mix the two or anything, right?
They some supplements they do have them together. They have like calcium and vitamin D together. They'll have it.
Okay.
Yeah.
Maybe they're doing that. Okay.
Yeah. You might have one of those, and they that's common. They do that a lot, so people don't forget to take them.
Yeah.
Okay. Does it help to do splits before the surgery? I guess to be more flexible. Okay. Did your sleep quality and duration change? He just mentioned that like CBD has helped him tremendously. Yeah. So Logan X sleep has went through the roof. This guy's getting 16 to 18 hours a day in terms of sleep.
Yeah, man, I'm sleeping this away. Not gonna lie.
Yeah, with his his CBD. Let's see here. Okay, so I guess this is can you bring somebody that it's gone bad from bad doctor? Okay, so I'm not sure what that question is, BD. I'm gonna skip over that. let's see here. Did the doctor, do you tell it, did you, so they're wondering like, does the CBD affect bone healing?
Yeah, from what I've looked into, it's totally fine. I mean,
Okay.
some of the physical therapists will actually encourage you to take edibles.
Oh, okay.
So yeah, I mean,
Awesome.
under the table, like low key, of course.
Right.
But
Right.
but yeah. So it's totally fine. CBD's fine. Weed's fine. It doesn't mess with any medication or any of that.
Yeah.
So the only choice is how you consume it. That's the important thing. So you don't want to smoke it. Smoking is really bad for your bone health. And yeah, that's pretty much it. Don't do smoking. Don't drink alcohol.
Right. Yeah. Alcohol too. That can definitely affect things while you're going through
I mean, I know people who do drink while they're doing this thing, but I would not recommend it because of the risk. It really increases the risk for blood clots, and that's just not fun. You just don't want to deal with that.
No, for sure. Okay, this is a good question. What's your schedule like for distraction, like lengthening? Each time you use the machine, and how much time do you need to wait before getting more millimeters added with the magnets? So, like, what's your lengthening schedule like?
Yeah. So, like I said, I wake up at like 12, and so I lengthen around 12:30. Then I come back from PT and everything, and then I do another one around 4 p.m. I mean, I have a really late schedule, I'm not gonna lie. And then I do another one at 9 p.m. and then I do my last one at 11 p.m. because you have like I guess until like the next day to do it, right?
Yeah.
And I have four cycles of lengthening per day.
Okay.
So it's around like 0.25 millimeters per day, or not, sorry, per rotation.
Per rotation. You're doing 4 times, so that's so 1 millimeter per day is
yeah.
Right. Okay.
Exactly.
Awesome.
So yeah, so honestly, I would just separate around 2 hours apart at least.
Okay.
For each cycle. That's what I've been told.
Okay, let's see here. Let's see. Do you have to pay for having the distraction machine with you? I think they gave it to you during the lengthening for free, right? It's part of the process.
Yeah, well, yeah, free in quotations, right?
Yeah, exactly. All right, cool. So we have a few more questions here, and then we're going to probably wrap up. We're going to let them get back and get some sleep. Let's see here. This is a good one. How do you plan on telling your friends, relatives, once they notice your height, or do they already know? Was it kind of like a family decision when you went through with this?
Well, see, I told my entire family, so that's very uncommon. I know that. So like my family would come visit me all the time. You know, I have aunts and uncles that just come by, which is really nice.
Yeah.
So I would definitely recommend telling people about it if it's your family. Now, when it comes to my friends, see, your excuse that you gave me was actually really good, but I am not able to say that quickly or efficiently to like another college kid.
Right.
So, because they're gonna be like, what does that mean, man? Like, what? And like, so what I'm gonna do is I'm gonna say that I went whitewater rafting and I just had an accident and I broke my femurs.
Yeah, that's
just
fine.
So you know, it's easy to say. You know, it's like quick. Right. If you're at the bars or something and someone's like, what happened to your legs? You could be like, oh, I just broke it during rafting or something, you know? It's easy. It's quick.
Yeah, and it actually sounds pretty cool too. It's like, you know, it's like
yeah, it's so you could tell girls and stuff. So
right.
But
yeah, mine is for like confusing people. It's like, hey, look, so they don't ask any more questions. But if it's like for the cool thing, yeah, I
guess you can make something up. But yeah, I mean, as long as you believe it, you can make it sound true, right?
Absolutely. Yeah. Girls don't need to hear all that, you know, rotational deformity stuff. You can tell like normal doctors that might, you know, if you go in for an x-ray like 5 years down the line, that you needed a rotational deformity if you don't want to say limb lengthening, but they might know if they're.
I feel like you should tell them. I feel like
they might need to know. Just to be safe, you know.
Yeah.
All right. Let's see here. Isn't vaping also smoking? It's actually different, right, Puro?
It's different. Smoking is just smoke, and vaping is more like steam.
Yeah.
I don't completely understand the contraption itself, but I mean, you could just look at the different pros and cons of each, and they're just wildly different. Vaping, I would not do over the long term. I mean, it kind of bruises your lungs over the long term, so I wouldn't do that. But for something like this, which is kind of short term, and you're kind of trying to avoid depression and stuff, I would definitely recommend it. But I mean, if you could do it without anything, I mean, that's good too. You know?
Yeah. All right, I'm just gonna type. Everybody's wondering where you got it done. Institute. Cool. All right. So we got a few more questions here. All right. So we'll answer this one and then we'll probably wrap up here, guys. So how do you feel about the limb lengthening community gate keeping what height is acceptable to get the surgery? Like saying you're already so tall, you don't need to get limb lengthening. So I guess, is there like a height threshold that you think should be placed upon this, or is it more what the person thinks about what they want to get in terms of height?
I think you should just do what you want to do, honestly. I mean, I've seen models get this done at Paley. I mean, like, I'm talking about like 5'10", like Chinese girls trying to be like models. So they like get their legs longer than they're like 6 foot or whatever. But yeah, I see all kinds of people do this. I mean, yeah, you only live once. Just do what you want to do, in my opinion.
Absolutely, man. You gotta, YOLO, go for it. Okay, so all right, so we'll take this question. Now they're trying to throw in the last couple questions. Will you go to your grave without telling your future partner, sons, in case you have them, you had a surgery that made you taller?
I probably won't tell my wife. I don't know. She doesn't really need to know, to be honest.
Yeah.
I mean, when you're 40 or 30 years old, are you gonna tell like your wife you got a surgery done and you're 20? Probably not. I don't know. It doesn't matter too much to me. So
right. Very cool, man. Awesome.
Yeah.
Very cool. All right, guys. So we are gonna wrap up in a minute. So we'll take one last question if anybody has it, and then we're gonna let Puro go so you can go back to sleep. Your boys can go
Thank you, sir.
Yeah, I know. I'm gonna try to get more sleep. I'm about to go get me a little CBD.
Yes, sir.
All right, going once, going twice, and we're out. All right, guys. I want to thank you all for showing up today. Oh, somebody's asking. I'll answer those questions once we let Puro go. Hey, man, Puro, we really appreciate you coming on to give us your experience about lengthening. Hey, maybe we'll have you back on for another, a couple months down the line, just to kind of, hear your progress when you're wrapped up, when you're all done.
Yeah.
Okay.
All right. Thank you so much, man. Thank you for having me. I love this show.
All right, man. Awesome. All right. So we'll see you next time.
All right. Take care.
Okay. All right, guys. So we are all done for today. Sorry if I didn't get to your questions. If I see any questions in here, I'll try to answer them. Somebody's asking about emailing Dr. Paley and Dr. Rosbrook, but I'm not getting an answer. So they're probably super busy. So just be patient. I know that if you don't get to them, maybe you can email their, their front desk or, helpers, patient coordinators or whatever. But they're probably really busy. These are two of the top doctors in the world. So they're, in terms of limb lengthening, so they're going to need to give them some time. So, hey guys, we are going to do, next week, we're going to have our surgeon back on, most likely if Dr. Robbins is available. We're going to try to get him back on. And so next week will be a surgeon week. And then I will probably do surgeon week. We'll have our physiotherapist back on. Then I probably will skip my week, since you guys kind of know the fitness and the nutrition. We'll probably bring on a guest week. We'll have either another surgeon or patient or something in that third week, where it's going to probably be a surgeon that I know everybody wants to have more surgeons. So we'll probably do that. But you guys can always leave comments down below this video. You can email me. I'll put the email for the Limb Lengthening Live. It's live@cyborgforlife.com. Email Limb Lengthening Live questions here. And then, Eric, I appreciate you showing up for the sessions, man. I really do. I think this is a really good way for you guys to get your questions answered, because I'm going to do more interviews. I have more that I plan on doing, but I wanted to kind of kick off this Limb Lengthening Live thing. I think it's huge, because this is such a big surgery that you need to know, you want to get like a lot of angles, but like Puro said, you don't want to like over obsess. You want to kind of hear patient experiences. You want to hear from the surgeons. You want to figure out who your surgeon is going to be. I try to put out some content out here. But at the end of the day, you want to kind of get as much information as possible to help you make the best decision. And that's what this is all about. So do I think there will be any differences in races? I'm not sure what that is. Quadrilateral lengthening and knock knee correction simultaneously. Yeah, they can do that. I don't know, actually. Just wait for the surgeon. But they can usually do limb lengthening and knock knee correction. Very cool. Zeno's I like that. That's the best way to elucidate your souls. Love it. Okay, guys. So I'm gonna roll out. We'll be back next week. And You can send me an email if you have any questions, and I'll see you next time. All right. Victor from Cyborg for Life, signing out.